come together with our partners on the VA side to bring you a program to give you more information about the PACT Act. But before I go any further, I just want to remind everyone that we celebrate Veterans Day every day here in New Mexico. And I certainly want to recognize the veterans in the audience and welcome home our Vietnam veterans. Thank you so very much for everything that you've done.
Good morning, everyone. Secretary Smith, thank you for bringing us together here. And my co-worker, Mr. Director Cesar Romero, who worked with me out in LA many, many years ago. And our representatives from our two great senators. I get to say our now. I've been here almost 6 months, so it's great to be here. Okay, so I'm going to do one thing here. Promise to address comprehensive toxics. It's really hard for me not to say toxins, but toxics. So it's all kinds of toxic things. So that's what PACT stands for. It's the promise to address all of these toxic things that have been in the environment with the military. We know about the most obvious and well heard of ones, Agent Orange. Warfare is different. It's electronic, it's a lot more chemical. We have all these different things that are in the environment. It's a lot more aggressive in the environment as far as vibrations and sounds and fuels and other toxins. And that's really what some of these slides will talk about, how that's different. This expands eligibility for VA healthcare for veterans. Millions and millions of veterans based on their service, where they served, what types of duties they did, and we'll talk about the presumptives, those medical conditions. Millions more veterans will be eligible for VA healthcare, and some immediately. For toxic exposure, going all the way back to Vietnam and addressing some of the presumptives and adding more to the Vietnam era presumptives, adding some more locations, all of those different things. Adds more than 20 new presumptives. And let me just take a second and tell you what a presumptive is. If you were in the location and served during, these decades, these periods of time for different locations, and Mr. Romero has a list of each of those, and you have one of these presumptives, whether it's a internal disease, a cancer, or some other type of disease, it's presumed to be from a toxic exposure or presumed to be from the environment. You don't have to go through an extensive medical procedure to try and tie that disability to your service. It's presumed, and you get the benefit, and you get to move forward with your health care in VA or in the community as VA is expanding. Okay, so 20 new presumptives for the burn pits and other toxic exposures. Adds more presumptives for Agent Orange and radiation exposure. Remember the radiation that we had since World War II. We've developed and people have handled radiation devices. We've had different radiations. A microwave puts off different types of microwaves, and there's radiations associated with many military devices that we use nowadays in the combat environments and even in the testing environments. So a lot of the radiation type things are now considered. Provides toxic exposure screening for every veteran enrolled in VA healthcare. So we're figuring out now how to go through, how to create our databases, and how to screen every veteran to see if they fit any of this criteria. It helps improve research, staff education, and treating related toxic exposures. So we as VA are committed, and we'll talk on some of these slides about the research effort we have to do, the education of our staff, and we're going to lean heavily into the treatments of all these different types of toxics. What's the best way to deliver treatment? And best practices, not just us VA, but interagency and with our community partners outside of government as well. VA wants veterans and survivors to know about the PACT Act and the benefits. And one of our commitments is not only the screening on the VA healthcare side and the outreach on the benefits side and our outreach on the healthcare side, but to veterans and to their survivors. And I always say to folks, as a veteran, as a military member, former and family member, what you know you pass on. That's your charge. Your charge is to tell other people what you hear and what you know about your VA benefits, your VA healthcare, and your memorial services. Okay, Sergeant First Class Robinson was deployed in Kosovo and Iraq with the National Guard. Once you're on active military service, it doesn't matter much to us where you come from. You're a soldier in the Army, and you're a Marine in the Marine, and you're an airman in the Air Force, and seaman in the Navy. Came home, had some illness, and later was determined to be lung cancer, immune deficiency, and passed away. That was really some of the congressional interest in where are we going, and the family fighting, and members that knew Sergeant First Class Robinson to fight for benefits for those that were impacted by the toxins, and in his case, the burn pits. Military environment exposure is really the catch-all phrase. It's the umbrella. Exposure in the military environment. And what is that exposure? If you think about it, it's the things I talked about: vibration, noise exposure, X-ray exposure. It can be noise, sound exposure. It can be chemical exposure to something in the environment, in the ground. It can be all kinds of different exposures. So that's the bigger umbrella concept. Within that, there's agents or chemicals or other things that have the potential to cause adverse health effects, either alone or in combination with other things. So, we just don't have an ailment in our body, or we're just not exposed to one thing. We're often exposed to multiple things, and there's this compound effect that it can have on us. The PACT Act defines the term, the specific term, toxic exposure, to really refer to, in the military environment, the exposures that are one to a substance. So they look for a substance. Then they look for the concentration of exposure. The simplest term would be a vitamin. If you had a normal amount of vitamin B, you'd be okay. But if you had a huge amount of vitamin B, the amount of exposure could make that toxic to you. So where vitamin B wouldn't normally be a toxin, if you had too much of it, it could become a toxin to you. So the VA is not only going to look at the substance, but it's going to look at the amount of exposure and try and determine that. And then it's going to look at the route the exposure took to enter your body or to affect you. Was it on your skin? Was it ingested internally? Was it inhaled as an inhalant? How did it impact you? So there's going to be a lot of research going on by VA partners, and our non-government partners as to how we do that. So we start off with these general types of exposure. We have to determine what they are and how they impact us. But the first thing we have to do before we can get to the exposure is to expand VA healthcare eligibility. So there's categories of veterans who are eligible, and it's probably better if Mr. Romero talks about the eligibility of each of these areas and walks you through those slides, and then I'll continue on with a couple other slides.
So getting into the actual toxic exposure itself, so the PACT Act, like Mr. McKenrick mentioned earlier, the PACT Act defines toxic exposure as a general matter that are several types of possible exposure or hazards that veterans may have been experienced or exposed to while they were in the military. So some of those more common exposures include chemicals, air pollutants, occupational hazards, radiation, and warfare agents. So from a claim processing perspective, when a veteran files a claim for any of the presumptive conditions, which we'll get into in a minute, that's what we look for in terms of exposure. And that's how we presume that the veteran, as a result of his current condition, that's how we tie it into his military service, is based on the presumption that because he or she served in a specific area, they were exposed to this particular toxic exposure, and as a result of that, they have the current condition that they are applying for a claim. So I'm gonna talk about the specific conditions, and then I'm gonna pass it over to my good friend, Mr. McKenrick, to take it away for the categories. So, like mentioned earlier, as a result of the PACT Act, we expanded presumptive conditions for service connection. And as you can see on the slide deck, there's more than 20 conditions related to toxic exposure. Most are cancers and respiratory conditions. So for Gulf War and post 9/11 veterans, you can see the list there. But also too, the PACT Act expanded service for exposure conditions for Vietnam veterans and veterans of other tactical herbicides, which is also annotated in the PACT Act. So as you can see there, monoclonal gammopathy of undetermined significance, or otherwise known as MGUS, that is one additional service connection as a result of herbicide or Vietnam service in Vietnam. Another condition is high blood pressure. And again, those conditions are now, as a result of the PACT Act, presumed, can be service connected under a presumptive condition.
When you go see your providers, ask them about that and have your providers explain each of those conditions that are now presumptive so that you have a better understanding of what each one of them are. Some are pretty simple on their face, but some are complicated. Okay, so what we're really doing is we're expanding. The law expands the categories of veterans. Veterans, those who participated in exposure risk activity. So it's risky activity. You either worked around these items, or you were near the burn pits or the toxic areas. As you go through the list in the information, you'll be able to determine if you think that was you were in the right place. You can ask to have your records researched through VBA to see if you qualify. Category 2 are veterans who are assigned to duty stations in these particular areas during a particular period of time. So on or after August 2nd of 1990, Bahrain, Iraq, Kuwait, Oman, Qatar, Saudi Arabia, Somalia, and the UAE, United Arab Emirates. So if you worked in those areas after 1990, or on or after September 11 of 2001 in the following countries: Afghanistan, Dubai, that's Djibouti actually, Egypt, Jordan, Lebanon, Syria, Yemen, Uzbekistan, or any other country determined relevant by VA. So there were other border countries that we operated in, and there were other staging areas in other foreign countries. So they'll be looking for that. And then veterans who were deployed in support of Operation Enduring Freedom, Operation Freedom Sentinel, Operation Iraqi Freedom, Operation New Dawn, Operation Inherent Resolve, and Resolute Support Mission. So those are different operations where if you were there in support of those missions, those things will help determine whether you qualify in those other areas. So here's a list of dates to go and look through. Veterans identified in Category 1 and 2 will be eligible beginning during these dates. So what it's saying is we're focusing on different dates over different times for eligibility to ensure we don't overwhelm the system, and focusing on those that were involved earlier on in those areas. So this list goes through October 24th, veterans who were discharged or released from 1990 through 2001. And then October 26th, veterans from 2001 through 2008. And then October 28th, veterans discharged between 2007 and 2012. And October of 2030, veterans who were discharged between 2013 and 2018. Veterans identified in Category 3 will be eligible beginning 2032. So depending on where you served and your proximity to those toxins determines the eligibility window for you. You can be eligible for VA healthcare if they have service-connected illness or conditions, or if they meet existing eligibility criteria. So there's an extended healthcare period, and this lays out that extended healthcare period. Between October 2022 and 23, veterans who served on active duty in a theater of combat operations during a period after the Persian Gulf War, or in combat against a hostile force during a period between November 98, who were discharged between September 11, 2001 and October 2013, may receive care upon enrollment for VA health care. Enrollment is free and there is no annual cost, and your care may be free as well. So no cost to do this or go through this process, but you have to get engaged and you have to work through the VBA. If you come to VHA and we start to diagnose, then we have to go to VBA and make sure you're eligible and get the eligibility cleared, and then you're good to go. Here's information about eligibility for the Vietnam era. So specifically, they go through specific dates for the Republic of Vietnam, Thailand, specific dates, Laos, certain provinces in Cambodia, Guam or American Samoa, territorial areas in the waters, so they're looking at the Navy as well, not just land, and then the Johnson Atoll, or a ship that called there during a specific period of time. So they have specific dates in there because they're looking at known activities when toxins were processed or passed through those areas during those periods of time. So that's for the Vietnam era. So we are expanding the mammography program through the PACT Act, and it's best to ask your provider what this means and what the eligibility is. And remember, I talked about the additional training we're doing for our staff. We've started that already, and we're continuing to get to all of our staff. This was signed into law on June 7th of 2022, and it expands the clinical mammography program, not only in screening, but also in treatments and supports for anything that's detected. So female veterans are encouraged to go through this with their provider. You can see the time periods. It's Iraq, it's Southwest Asia Theater, Afghanistan, Dubai, Syria, Jordan, Egypt, Lebanon, Yemen. Other locations located to airborne hazards and open burn pit registries. So if you think you were in those areas and you qualify, you get on a registry, and then you'll be eligible for the screening and the care. Other locations the VA determines with the Department of Defense to be relevant. It doesn't change the healthcare enrollment or claims and benefits application requirements. You still have to, if you're already in VA, ask about the healthcare and the screening. We do normal mammography screening to begin with, so we're just building on top of that. But if you're not in VA, you go to the benefits process, you determine your eligibility for these areas and this type of screening, and then you'll be able to get the health care associated with that. So beginning in November of 22, very shortly, every enrolled veteran will receive an initial toxic exposure screening. So we're going to screen all of the records, and anyone that fits any of the criteria, even remotely, will get special discussions with their providers as to screening if they have any of the presumptives, or if they seem like they fit any of the criteria. So we're going to start on our side and do the health screening aspect of it, and then there will be recommendations for referrals back to VBA to go through the benefits process. Follow-up screenings, and at least once every 5 years for people that meet that criteria. So VBA is your gateway to the healthcare, but if you're already in the VA healthcare, we're going to already start the screening process on those that appear from our database searches to fit the criteria. But of course, you can have that discussion with your provider, and we can figure out if you really do fit it, or if there's some other exception in there or other area where you might fit that's not obvious to everybody. Veterans not enrolled who meet eligibility requirement will have an opportunity to enroll and receive the screening. So if you meet the eligibility requirement and you're coming into VA, you can get that screening as well. Providers and claim processors will also receive additional training. So I talked about that training. We're going to do more training on our side, and Director Romero will be doing more training on his side. The VA will publish a list of resources for toxic exposed veterans and veterans who report toxic exposure. So there will be more information coming out, more websites, more places to go to get additional information and to share information. It'll be relevant to you as veterans as well as your families and caregivers, those that are assisting you. So make sure others know about these websites. Remember my charge to pass it on to others. VA is going to develop outreach programs such as this, as well as additional benefits and support. So these are some of the resources. I'll leave these up here for a second. These are links. Probably the best one there is to call 1-800-MY-VA-411, which is 800-698-2411. That's a centralized source where you can ask questions and be given additional information. They can give you websites, they can give you additional phone numbers. In some cases, they can even transfer you. In this area, if you look at those individual studies, on the VHA side, we have the nation's largest research entity because there's 178 medical centers. There's over 1,000 clinics around the communities. So we are the largest healthcare entity. We train probably a third of healthcare practitioners. At one point in their career or another, they will pass through VA doors, either in a clinic, an ambulatory care center, or a medical center. So not only do we have the training, but we have this large research arm. So our ability to look at the mortality of veterans who served in Southwest Asia during the Gulf War, the post-9/11 veterans' health trends, we have the ability to track that. And we have to develop that even better than we do it today. Veterans' cancer rates, we need to track all of that. The effects of toxic exposures and mental health outcomes, are they linked? And if so, how do we start treating those with different types of treatments to be developed through research? Effects of waste related on the Manhattan Project. We talked about all those other things that went on related to radiation that military were exposed to, some going way back. That hits home here in New Mexico. The state of access and barriers to benefits for veterans in U.S. territories. So now we're not just thinking of the U.S., but those outside territories, the elements that are harder to serve because they don't have the quantity and quality of service that we have immediately here, but we push out what we can to them, and how do we serve them in their communities that are somewhat underserved, more remote. Another challenge for us in New Mexico, our rural and highly rural areas. And the effects of jet fuels, obviously all of the aircraft and the air superiority that we enjoy in combat and our forces enjoy today to be an agile, mobile force takes a lot of jet fuel, a lot of toxin there. So looking at exposure testing and treatments, and how do we develop that through our education processes and through our research. This is part of the proactive engagement that's promised, and we'll continue to do this, as well as working through what registry lists we need for different things.
So good morning, everyone. My name is Robin Wilson. I am the Division Director of Field Services for the New Mexico Department of Veterans Services. And I wanted to take just a brief moment to discuss with you how DVS can assist veterans of New Mexico with the PACT Act. Currently, we have 20 veteran service officers located throughout the state. And as of yesterday, we are going to be opening up additional positions so that we can not only increase the number of veteran service officers, but increase those locations. Our Cabinet Secretary, our Governor, and myself, we're very dedicated to not only our veterans here in the Albuquerque area, but our veterans throughout the state. And as we kind of mentioned briefly, that includes our highly rural veterans. We understand that it is very difficult to come into some of the larger areas, and so we want to make a plan and a promise with our veterans to come to you in the rural areas. Now, as you can see, these are currently the locations, and we're certainly happy to share the phone numbers online with all of our VSOs in those offices. But this just gives you a brief showing of where we're located currently. So with our veteran service officers, what we are planning on doing and what we've been training additionally for about the past month and a half is assisting our veterans in filing service-connected claims, but also assisting our widows and our widowers to determine if the veteran that has deceased was eligible for that service connection, and assisting those widows and widowers with any kind of pension or any type of additional claim from there. If a veteran has previously been denied, we urge you to contact us. Let's talk about that and determine whether or not you have something that we may be able to appeal for future claims. We also can assist a little bit with the VA health enrollment. We can talk you through the process, get you in with forms and with VA healthcare, with VA benefits. We work very closely with the VA hospital and with the VA regional office in Albuquerque, and we can be that bridge to connect you to those two locations. One of the things that we're very good at is assisting veterans recreate and obtain their records. So if you are a Vietnam veteran and you've just lost records, throughout these past 50 years, we are certainly happy to help you in finding any records that you may need to help prove your VA disability service-connected claims. And that's our dedication to the state of New Mexico and to our veterans. It's one that our Cabinet Secretary has stressed every day is Veterans Day, and it's one that we take certainly passionately and professionally. And along with that, we do have, if I may, Diane, talking about our highly rural transportation grant, I just want to ensure that the finalizations on exactly what counties and how that process is going to work will be completed any day. And so that will allow veterans within the 15 most highly rural counties throughout the state to be able to receive transportation services to the VA, whether it's for health care or whether it's through any VA appointments. So those are things that we're very excited about to assist with the PACT Act. Thank you.
As you can see, we've come together to make sure that you are getting the information that you need so that you do not leave your benefits behind. Everyone here has served honorably and you have earned these benefits. So please take advantage. Thank you so much, Mr. McKenrick, for your words and comments. Thank you, Mr. Romero, for your words and comments. And thank you, Ms. Wilson, for your words and comments. So one of the biggest takeaways that we want you to have today is that we are all here to serve you at the end of the day. Because you're veterans, we want to make sure that there is a seamless approach to how you get, again, the benefits that you've earned. So with that said, we will open the floor for any questions that you may have.
I'm Megan from Representative Stansbury's office. So I just have a question about the appeals process. So the appeals process can sometimes take 2 years. Is there a way to, expedite it for people who qualify under the PACT Act? Or are there any plans or processes to help the appeals?
Part of the PACT Act, what VBA is doing regarding those claims that were previously denied, we are reviewing those claims. So if you are a veteran, let's say you applied for asthma, and at that time you were denied, we are looking at that claim to see now if it should have been granted. But with that, if you filed a claim previously and it was denied, I would encourage all of you to file a supplemental claim, which will restart the process and look to see if we can service connect that previously denied condition under the presumptive basis. So, ma'am, very good question. So what I would say is, again, the VA is looking at those previously denied claims that may have been part of the PACT Act to see if anything changes or if anything can be changed with our decision. However, if you have been previously denied and you believe that your service connection is a result of Gulf War exposure or a result of the PACT Act, then I would encourage you to file a supplemental claim.
Good morning, everybody. My name is Terry Obago. I'm the Native American Veterans Program Manager at the New Mexico VA Healthcare System. I do extensive outreach in the Native American communities, and I help every veteran that comes to my doorstep. So my question is, and I've been receiving these quite frequently from Vietnam era veterans, is some of them do not qualify for VA healthcare because of their income and other requirements that they don't meet. So they kind of leave it there, and so, but are suffering from the conditions, medical conditions that are on the presumptive list. And so my question is, because they don't qualify for VA healthcare, income guideline or whatever it is, and and they're not registered in the Agent Orange registry, how do we get that on their records, or how do we proceed to get them care also for the mental health initiatives as well?
So let me just turn it over to Director Romero to address the benefit side and going back with, what's now available under the PACT Act, and then I'll add the healthcare piece on the end.
Thank you. Very good question. So, first of all, I would say for anyone in the audience or anyone online, if you are being turned down for any type of benefits, or if you've been previously turned down for any type of benefits, I would encourage you to stop by our office so we can help you talk you through the whole claims process, because like Mr. McKenrick mentioned earlier, the benefits and the health care, they're tied. And if we can service connect something, or if we can get the veteran service connected, then that usually equals some sort of health care treatment that's provided. But also too, under the PACT Act, like we mentioned earlier, not only did it expand presumptive conditions for Gulf War veterans, but it also expanded the duty locations for Vietnam veterans that may have been exposed to herbicides. So with that being said, what we would do is we would relook at their claim, relook at their file, and see if there's anything under the PACT Act that we can help get them service connected. And then once they get service connected, then there's a slew of VHA healthcare benefits that they'll be entitled to. So the first part of that question, sir, is I would say if you encounter a veteran that's saying, I'm not eligible, I previously applied and I can't get benefits, please send them to our regional office or have them contact our regional office, because we want to relook at that file, relook at the evidence to see if we can service connect them.
I'll just back up a little bit and talk about how we think at one point or another we understand VA period, or VA benefits, or VA healthcare, or even our own bodies. But the rules change. The eligibility amount changes, so you may be close and be ineligible, but then as the amount changes over time, you could be eligible. That happens. Something like the PACT Act comes along and changes the rules. So now there's all these presumptives and there's these dates and times. So you may not have been eligible before, but you are today. Your body could be rated today or have service connection for a hip injury, but 5 years from now you're having trouble with your knee, and your knee is on the same side as your hip, and that's related. As your body changes, they could be related, and that too could be a VA disability related to a pre-existing or other disability that the VA has already acknowledged. So the theory is the system and you change throughout time. So make sure you know the newest information. Make sure you're getting up-to-date information. Make sure you stay connected. Make sure you're talking to your doctor about your physical conditions and getting things reevaluated throughout your life that may be connected or caused by a disability that you already have that's connected. So service connection is key to the answer, as Director Romero said. It's important if you can get that service connection, then you have everything. So there's also, if you go through the PACT Act criteria, if there's a 10-year clause, if, it's in the material I gave you when you walked in, if you fit some of that criteria, you get coverage for 10 years while we figure all this other stuff out, so you can get health care coverage. So there's different eligibility criteria. I can point to some of it here. And the important thing when you go through the PACT Act, and I discovered it right away on reading the drafts and the final version, is there's specific call-outs for the Vietnam era veterans, and then there's call-outs for the post 9/11 veterans and the Gulf War veterans. So make sure you're looking at the criteria under the right area. But there is a clause in here for 10 years of healthcare eligibility if you fit the criteria under the PACT Act. And that eligibility, because we talked about one of the things we have to do research is, how are these toxins impacting mental health? So if you're really trying to get that mental health, and we haven't figured it out yet, that would be covered under that criteria. It would have to be a special finding for mental health. But getting engaged and getting back to the service connection is the most important part.
So the final part of my question is if for example, if I had a veteran who said they were diagnosed with a cancer condition and went through the treatments and got it all done, can they still file a claim even though the cancer is gone now?
Yes, they can. Whether the cancer is in remission or whether it's completely cancer-free, they can file a claim.
Thank you. That would be all my questions.
Thank you. Yeah, in terms of veterans benefits, claims, compensation, I encounter a lot of veterans that say I'm not eligible or they believe that they will not be service connected. And my whole philosophy is you should file a claim and get the official response before you make those conclusions. So the bottom line, at least from my perspective, is if you encounter a veteran that believes they should be service connected as a result of the PACT Act law, I would highly encourage them to file a claim. And again, they can file online or they can come to our office in Albuquerque and we can help them file a claim.
So the particular guidance relative to post 9/11 combat veterans is if you meet the requirements listed, and we went through the locations, we went through some of the dates and time frames, if you meet that criteria, you can get free VA health care for any condition related to your service, so service connection, for up to 10 years from the date of your most recent discharge or separation. And that would be the mental health service as well. You can also enroll at any time during that period to get any care you need, but there may be some co-pays associated with some of the other care that's not service connected.
I was listening to everything. I was a little confused. Is the PACT Act, does that cover Vietnam era sicknesses? Is it two different things? The PACT Act is one thing, Vietnam era is a separate thing. In other words, let me put it this way, I was in Korea on the DMC, and they have a 4-year window that if you were on the DMC within this 4-year time period, I think it was 1968 to 71, while I was there right in the middle, and I was exposed to Agent Orange. And so you're saying there's a list of presumptive sicknesses. Does that cover, is PACT Act covering this? Or are that two separate things? I can't explain it.
Right, I understand your question. The PACT Act covers Vietnam era veterans. It expands some of the presumptives and it relooks locations and things. So it does impact Vietnam era veterans. And the other part of the PACT Act is the Gulf War and post 9/11 veterans. And they go through periods of time and locations in each of those. The very best thing you can do is, if there's any confusion, go to the Veterans Benefit Administration, speak to those folks that work with Director Romero, and they will walk you through the specific eligibilities and look at your records and see if you qualify. So you don't necessarily have to figure it out yourself or alone. You're able to do that. If you can't get to his office, you can use the representatives from the State Department of Veterans Services. They will be able to help you.
Okay. Now, do you have a list of the updated presumptive illnesses?
We do. Yes, sir.
Do you have a list here, or is it?
I have it here, it's online, we can share it with you, we can email it to you, we can do all that good stuff.
I appreciate so much that you all are doing this today. I think, how many people do we have online? 35, 40-ish? 17. So y'all, Director McKenrick, Cesar, we've been around the state a few times. Highly rural, really bad broadband, Wi-Fi. Y'all know that I'm a commander of a Legion. Most of my Legion members are Vietnam era. They don't know how to use computers. They don't see very well, they don't hear very well. So this is such important information. As a post 9/11 veteran who is now looking at inactive duty for training on Category 1, myself, I'm myself, I can't keep up with the note taking. So I'm just imploring y'all to go on the road, get with your VFWs, your American Legions, at least start from there, because those guys, the guys and gals talk to everybody, but whatever we can do to help, but this information is really important, and it's confusing, so anyways, but thank you.
Thank you so much for that. Just a footnote, we get it. That's why today is a starting point. We are committed to making sure that the veteran community and our families understand how important this is. So you will see us working together. As Ms. Wilson shared, we have VSOs all across the state that are standing ready to assist. She's putting together a plan to be more mobile. We call it a mobile team to go out and assist. So, and I'm sure that the more conversations we have with Mr. McKenrick and Mr. Romero, we're going to continue to make that happen because, as you said, it is so important. We do enjoy very good relationships with our local posts and our American Legions and our DAVs, so they will be engaged as well. Thank you. Any other questions? Nothing from online, Teresa? We're good? Okay. All right then. Well, we have a charge from Mr. McKenrick to make sure that everybody knows. For people who aren't veterans, most of the time they know a veteran. So you can always just ask the question, have you heard about what's going on with the PACT Act? And if you haven't, let me put you in touch with some people who can help you with this. So if there's not anything else, I think we will be around to answer any questions that you may have. But thank you so very much for your time this morning. And again, there's more to come. Okay. I want to thank the people online. I'm sorry. Thank you.